I think the main thing that the training gave us was a better insight into the levels of services that are available to us. I think it's very common, I guess in any sector, isn't it? We work in silos.
For the next sort of cohort that we look at and bringing into our service, we're going to actually use that to look at their physical health and understand exactly where they are at themselves, because it isn't always that easy to unpick that with someone who may themselves not know. We'll work with their support workers about understanding about their physical health and potentially, you know, is there need for a character assessment to take place before that person moves into a tenancy, and making sure that that wraparound support is there.
This idea of putting into our work and into the kind of culture of hostels and outreach teams and things to think about end of life and to think about the longer term work and the kind of dignity and the kind of respect that comes with good quality end of life work, I think is what this training did. It's kind of adding that to our kind of style of working.
Our model, Housing First, being the main support mechanism for those clients, then those are the conversations we're going to need to have, and being able to have that support around it as well, to be able to help with those conversations, because naturally I think our team, the more they're presented with that, the more they'll know how to have those conversations.
Lots of this is about choice. So these are people who might have lived in homeless accommodation for a long time, where there's really strict rules, where you have to live where you're placed, it's not optional, there is no choice available. And so actually this opportunity to give people end of life care might be the only time they've ever been able to be properly looked after, to properly address their issues, and to actually have somewhere safe to live. And if what it comes to is the point at which just before they die, there's at least that.